morning, and thank you for keeping it Citizen Television. We really appreciate your time and company, waking up with us every morning. We do not take it for granted. Of course, today we are shifting gears from the discussion on matters, politics, and what is happening in the country to now something also that is very pivotal. We know that this week is actually the climax of just creating awareness around hearing loss, hearing impairment, and just better hearing care, because on 3rd of March annually, actually globally, it's the World Hearing Day, something that was set by the Office of Prevention of Blindness and Deafness of the World Health Organization, something that we usually mark each and every year. And today I have an expert with me in studio who will be helping us understand not just about the World Hearing Day, but also what you need to do to generally just take care of your hearing care. I'm talking about Dr. Richard Mwangi. Dr. Mwangi is a consultant audiologist, and of course he also works with the Doctors of Hearing here in Kenya. Asante sana for creating time for us.
Thank you very much. It's always a pleasure coming here to educate our viewers.
Thank you. Always a pleasure to have you. We're having this discussion. It's not the first time you've been on set.
Yeah.
And always is, insightful conversations around how we can hear better.
Yeah.
You know?
Yeah.
All right. So let's begin from what's happening this week. On 3rd of March was the World Hearing Day. And I just want us to talk about the significance of this day and cascade it down to our country, Kenya, because it's a global event. And people would be asked, so what? You know, so what happened in Kenya? What were some of the activities around, around that day? And what were some of the objectives of even doing those things? And is it something that we have been part of? And what are you seeing? Are you seeing results as professionals in the sector?
Thank you once again for having me. As you have correctly put it, is that every 3rd of March is a World Hearing Day. And a lot of activities surrounding the hearing healthcare went through. The Doctors of Hearing, we had quite a successful one happened in Murang'a County, where we are doing more of changing the mindset of what people have known as a hearing problem being of old age. Apparently, hearing problem can affect anyone at any single age. Somebody can be born with it. And it's high time we continue making this awareness to each and every one. You realize that globally, 20% of population suffer from a significant hearing problem. And coming back here, Kenya, is that you find that 3.5 of males have got a hearing problem, and about 4.5 of women percent have got a hearing problem. So it's an issue that need to be discussed. It's an issue that need to be talked about, because it is affecting each one of us somehow, directly or indirectly, in matters of daily life.
All right. So, of course, we'll talk about some of the common causes and even what to do in case you're already part of the numbers that you have shared. Is it 20% of the population?
Global population.
Global population.
Yes.
In case you're part of the 20%, what do you do to have, improve your life? But then again, let's begin from the very basic. Sometimes it's very difficult for even parents and caregivers to catch it. When kids are young. Let's start there, because there are people who have grown with it, and maybe it was discovered late in the stage of them growing as children. Probably talk to us about the complexities of catching hearing impairment, especially at that stage of life, the childhood, the infant stage.
First of all, I would want to define what hearing loss is, because people think that it is being deaf. Hearing loss, it's either partial or complete inability to hear. So those people who've got a partial hearing problem may think that they don't have that kind of problem that need to be addressed by people like us who call ourselves audiologists. But it need to be addressed because it has got quite of challenges by itself. But how do you know that you have a hearing problem? Most people don't know exactly where they have a problem. You'll find that their relatives, their spouses, their children, they keep on telling them, look here, the TV, it's high. We keep on telling you, talking to you, and you hardly, hear us. We have to raise ourselves. And what I would want to tell our viewers is that if you see somebody who's got a hearing problem, it's not about the loudness. It's about talking clearly to them and in a different rephrasing if they don't hear the first time. But also, I may find that people might have a sudden hearing loss. You sleep today and you wake up with a hearing problem that needs to be treated with emergency reserves. Don't wait, because that can be reversed. But in about 90 to about 95% of cases of hearing problem is that you find it is a gradual process which has been there over a period of time. Yeah.
So it's not something that people are born with?
No, you can be born with. You can be born with. In most cases, in fact, what we found, especially during our World Hearing Day activities, that there are more children. That means this is a congenital problem. That means they were born with this hearing problem. And it has taken time for some of them to get solution. Maybe one, this literal awareness of where they can go and get the solution. Two, the services, maybe they are not available where they are. So with the statistic we got from the ground is that you find that most of the children were born with a hearing problem, and then what parents were coming to tell us is that this child doesn't talk, delayed speech, I've been told to do a hearing test, there's nowhere to do a hearing test within this area, things like that. So you find that this hearing problem, children are born with it, and it is also good for them to have a hearing test at birth, something we call newborn hearing screening. And especially if it was what you call high-risk pregnancy, maybe there was high blood pressure, the mother had high blood pressure, diabetics during pregnancy, or any other complication, and then the child was born preterm. It is very important for them to have what you call newborn hearing screening, which can be done even the day one of birth.
All right.
Yeah.
So to what extent, you've talked to us about maybe one of the biggest challenges is maybe lack of these services and these facilities, or even sometimes even experts who can actually, take a parent or a caregiver through that particular kind of an exam. But to what extent can also the lack of help for these young ones be attributed to the stigma and the denial that the parents, usually go through at that stage? Do you find this a challenge also? Because no one would want to accept easily that, their child has a problem, or they are being branded as deaf at that young age. So you'd find the parent is taking time, believing and hoping that the child will start hearing at some stage. Do you find this a challenge as well?
Yes, the stigma, the denial, and what you say that the children, the mother, the parent don't want to be branded that they have a deaf child. But as I started saying, is that hearing impairment is not being deaf. It can be partial or complete. So what we find more is the stigma, denial, and the meds, which are incorrect. You find that maybe as a parent you have this child, the milestone, one of it being development of speech, it's not happening. And then because, you interact with other individuals, the relatives, they're telling you even the uncle of this child talked when he was 10, 15 years. That's not correct. The good thing is that when you find that the child cannot turn when you're calling the name, even before they get 1 year, maybe 1.5 years, they cannot, turn because they'll be tied to align to the voice of the mother so much. I mean, it's high time you get to look for solution. It can start from the pediatrician. Then the pediatrician give you the way of referral. The pediatrician will know that this needs to be seen by the audiologist. This needs to be by ENT. This needs to be seen by speech therapy, and then can refer you. But not keeping quiet and allowing this child to just grow without looking for solution. Because if it is checked in early enough, let's say by 3 years, maybe 2.5 years, you'll find a very successful case where you find that this child will develop speech with peers or the age mates and can be able to integrate in normal school. So most importantly is that what you tell our parents, or what you're even telling those people you found there, is that, look, it's not too late, but at least you've come. Let's see where we can start from here. But I'll urge the parents to look at it from, early enough. If there was complication, how your pregnancy was, let the child be screened as soon as you can, because as development of speech happens, it has to happen because the child is hearing. If there's no hearing, you cannot develop the speech.
That's
correctly.
true. And it's better to just go, get it checked and rule it out in case there is no problem.
Yes.
just rule out that there's no problem or there's a problem, so that if in the event there is a problem with the child, they can begin, assisting this child. There are assistive devices. There are so many things that can be done so that at least this child can achieve their quality of life alongside their peers. So let's talk about the common causes of hearing loss. If you look at what is happening in the society, what we do, cutting across from children to even adults, what are some of the compelling causes of hearing loss today as we speak?
Common causes is that you can be born with what we call congenital hearing problem, depending on maybe the development of the child or the pregnancy was. But then there is another one, we say acquired. So you can either be born with this problem or you can acquire it. Okay? So acquiring means that it must have been caused by different thing. Maybe you were born hearing and then something happened. Let's say there's some medication we call ototoxic medication. These are the medications that damage the hearing nerve. There is what we call a noise-induced hearing problem, and that's something that can be preventable. Noise-induced? Yeah.
You exist or you spend most of your time in an environment that is too noisy?
Let me just break it down because it's affecting anyone.
Please.
So what exactly is happening? A noise-induced hearing problem is where you have a hearing problem as a result of noise. And let's not just think the people in the matatu industry, the Juakali sector. Let's just think as individuals, because nowadays you find that everybody is having something in their ear, listening to their favorite station. Okay? And maybe the volume is too high. If you hoot behind them, they cannot even hear. If a motorbike is riding behind them, they cannot even hear. So if you keep on exposing to that kind of noise every day, every morning when you're going to work, and even when you're exposing yourself to the noises that to too much noise that will continue harming your hearing. So it's no longer the matatu industry, it's no longer the Juakali industry, it's no longer the entertainment industry, because those also, they're at high risk. But what can they do? Because they need to work, is it?
Yeah.
People in Juakali industry, there's something called noise plugs. They're custom made, and there's some that are available, in the supermarket, in the pharmacies, and they can be bought. I'm sure you've seen people maybe in the airport hanging things, orange things, and when they are directing the plane on landing, or the people with the carts there, they put them because they want to protect their noise. Such a simple thing can protect people in the Juakali industry, and it's very cheap to get that one. So that can be prevented. Things that cannot be prevented that causes hearing problems that hereditary. It can be genetic. Another thing that can be prevented is using of Q-tips or the cotton buds, where you find people using cotton buds, putting them inside the ear and cleaning their ears. Because what they do is that they push wax. And when they push wax, it comes a time that it blocks completely. But that can be cleaned. And then, this person
so how do you do it? Because that's very common. Using the cotton buds, it's a common practice in every household.
Yeah, I get
so how do you clean your ears?
Just leave it.
Recommended way.
Just
you
leave
don't need to clean.
You don't need to
even
clean.
For children.
The much you can do is just using the bathing towel and just wipe around the ear canal. Putting things beyond. If those cotton buds, they are written themselves. The manufacturers, they write it. So you're not supposed to put it inside the ear canal. So you're not supposed to do anything to that. When you do that, you push wax further. I normally say, this cotton
wax
buds.
Is not a bad thing. It's
not a bad thing.
Wax that's the.
In fact, it's a very important thing. It's a very important thing because it helps in trapping dust. It helps in trapping insects that might get into the ear. It helps in trapping, any microorganism can be in air and go inside the ear canal and cause. So it's very, very important to have earwax. So in fact, when we look at the ear, for the 2 decades I've been operating as an audiologist, is that when I look at the ear and I say, there's a significant amount of wax, not, too much impacted. You can see the eardrum. That's good. And people will say, I need to be cleaned. I say we clean what we see. It's good enough to be cleaned, but you just don't clean.
Right.
Yeah.
You can't have too much wax that blocks you from hearing well?
Yes, there's some people who've got high production of wax. You find that there's some people who have to see annually, and clean their ears. But then there are not many. majority of the population is that the production of the wax is what is needed for the ear.
Right,
yeah,
right.
yeah.
You had that. Wax is not a bad thing, yeah?
It's not.
You actually thought it was dirt. You need to clean it up. That habit of always taking that cotton bud inside your ear, you're trying to clean the wax for yourself, even for your child, Daktari says here is not advised. I mean, just leave it there. There is a reason it exists. Yeah. Unless it's too much, then let the experts do their job. All right, so how can I or someone begin to know that I'm developing hearing loss, or I'm beginning to have a problem, or any signs, or that can tell that you're beginning to develop that challenge?
That's a very good question you asked there, because most people come when the hearing impairment is such an advanced stage, and you may find that rehabilitating it becomes quite of a task, and then they are looking solution as up at that point. But how would you know that you're developing a hearing problem? One is that we say hearing problem is a gradual. It's quite of a gradual process.
It doesn't happen like overnight.
Yes, there's one that can happen overnight. I say it's sudden sensorineural hearing loss. That happens and can be reversed if you go to the doctor immediately for treatment. But in the majority of the cases is that it is a very gradual process. In fact, when you're taking the history of a patient, you ask them, how many years have been had this problem? They'll say 2 years, 3 years. And I say like that, you say this must be about 5 years. Because you can't tell that you're developing a hearing problem by yourself. What will happen is that very people might notice, yes, but then you'll find that you start increasing the volume of a radio, TV, the house, to an extent that if somebody else comes,
they feel uncomfortable.
It's too loud.
But for you, you are okay.
You're okay at that point. That means, the hearing is not as good as the other person. The other thing is that you start finding that you want people to talk in front of you. Okay? Yes, somebody talks like you can say that's you talking behind me, but I cannot really understand what you're saying. So when you come in front of me and I can understand. But what people mistake by saying that is not that, yes, you are hearing, but also you are doing more of lip reading, where you find that you look into my lips and then you can hear a bit and then you can converse and engage in a conversation very well. The other point is that you start finding that you don't go to the social gathering. You stop going to church, you start going to meeting friends, because you are afraid that whatever they might be discussing there, it might not be clear to you. And when given a chance to contribute to such kind of discussion, you might get out of the topic. For the years that I've worked, I've got enough cases of such a kind of people. You find that I'm telling you that I was in this meeting of a women group, and then I was told to give a contribution towards the discussion. But then I went on praying for the closure of the meeting, but that was not the case. I was supposed to contribute. And you find it's kind of an embarrassment for that kind of person. So most people will be told by their relatives that, I think you need a hearing test. And when you are told by your relatives, your spouse, that I think you need a hearing test, just take an initiative to do that. Because it is either you have it or you don't have it. And when it's known early enough, it will not be so much of an issue to manage it. Because even if it's a mild hearing loss, it can be managed very well. You might say that mine, I was told, is just mild. It is not just mild, it is a hearing problem that need to be sorted from that age. And that point, when it's sorted out, you can find that it is not progressing the way, by leaving it like that. We also talk about the benefits of good hearing towards the brain. I'm sure this is a topic that we can discuss. Yeah.
Let me take you back a bit to the causes. There's something we observe with our senior citizens. It gets to an age where they can't really hear you easily, and you have to either increase your volume when you're talking to them, or just sort of you even accompany your communication with other things so that they can understand. I want to understand the connection between age and hearing impairment.
Yeah, that's a good question. There's what you call age-related hearing loss that happens as the aging process. So what happens is that, and also not to every individual, you'll find somebody is 100 years and maybe their hearing is, it's not bad, okay? But this age-related hearing problem, which is said it started for about 60 years. Some people say about 55, say about 60 years. So that happens also in a gradual way. where also you find that you start finding that when our senior citizens want to go maybe to the airport, they want to be accompanied because they cannot hear the PA system, what's the communication. Maybe when they want to go to the bank, they want to be accompanied because they want to be held by the person who is accompanying them. But they can be independent by looking at it on a rehabilitation part of it, where you find that in most of this hearing problem we're talking about here, today's hearing devices, they are so discreet and so cosmetic appealing, and also with a lot of technological improvement, where we say that they are using artificial intelligence. It's no longer the big beige, device. So when I sit here and then people say that's the hearing aid guy, it's not the big beige hearing devices. They are cosmetic looking.
They look really cool.
Yeah, they're looking very. I remember there's a media house I went to, and I was wearing one as a Bluetooth device, and nobody could notice. The host was asking, "Did you notice I was wearing something?" No. And I had it. So they are cosmetically appealing because, I mean, this idea of breaking the stigma and changing the mindset, even the manufacturers of these devices are coming to understand that it is a need, yes, but also so much is a need. This need doesn't need to be that big. There doesn't need to be only one color. It is, if you're dark colored, you have something for your color. If you're light skin color, there's something for your color. So it's no longer that stigmatized devices that people used to wear. And what you see nowadays that so many people are wearing it, but you can hardly notice. Because I normally say that it's only 2 people who notice that you're wearing a hearing device. The wearer will look at another wearer's ear, or an audiologist like me will look into another person's ear, because I mean that's how we operate. That's how we are wired to be working. So it's not every day that you see or you'll be seeing that you're wearing something. So however mild the case is it, look for a solution, because if it starts getting to moderate severe, it's quite of a challenge.
And it can get there.
It gets there. It starts from mild and it worsens. Right. The more bad it is, the more difficult it is to rehabilitate.
So the reason I asked you about the senior citizens is because I wanted just to clear it. It's normal that sometimes it can get there.
Yes.
It is not necessarily, it doesn't have to be like it is induced by something or they failed somewhere.
Yes, that's
true. It's okay that as you grow old, there is an age you can get that you begin to have that challenge.
That's true.
That's okay. It's
that's
part
true.
of.
True. Yeah.
All right. So let's talk about how hearing loss impacts, your life generally.
Yeah.
We may ignore it, like, it's just mild, I can manage. But then without looking at the bigger picture. So give us the bigger picture.
The bigger
picture. If
it's
not addressed, how does it impact someone's life?
The bigger picture is even a bit sad.
Yeah.
But what I want to say is that when you have a hearing problem, it is good for it to be tested. We say that. But the impact it gives society is that you find that people are not quick to look for a solution. 1, because the hearing impairment is not painful. 2, there's no those triggers to make you rush to the hospital, the inflammation, the fever, all those things, they're not there. But then you find people get delayed from mild, moderate to severe. Or even they tested being at the mild level, and they continue saying, mine study is mild, it doesn't have an issue, things like that. But what is it happening? What is back end? What is happening to your brain? We normally like to say that we hear through the brain. The ear is just a channel to take the sound to the brain for understanding. So take it here. There's hearing and there's understanding, is it? So I told you, when you started this, somebody can hear somebody talking behind, but they cannot understand. They want to have this person in front so that they can have lip reading. They can look in this person's lips and get to understand. So there's hearing and the understanding. So we understand through the brain. So we are communicating with you because we can speak the language that we are. So for instance, I do this interview in a different language and you don't understand. We will not have a communication, that's right. So the much that happens is that there's what we call cognitive decline. When you talk of cognitive decline, you're talking about the effects of hearing impairment, what is causing the brain. Okay, so if there's no sound or there's no sufficient sound getting to the brain, there's what you call atrophy. The brain becomes smaller. Not in a way that you may notice. Or even to make our viewers understand, let's say you come here, you've done a different language, maybe French, maybe Germany, you don't practice with anyone. You forget, right?
Yes, that's true. That's true.
You forget, right?
Or even if you go for driving and then you just never drive.
You have to do a refresher.
Yeah.
Yeah. But matters of brain is that this language, let's say I go and do maybe a foreign language, not mentioning any, and then I come here, I don't have anyone to practice with it.
Yeah.
I'll forget this thing because there's no constant stimulation towards where this language was told, is it?
Exactly.
So when you don't hear very well, the speech, the language that you have is not in constant use. So you find that this person start having, if they was pronouncing the word school properly, you start finding them, they have got kind of a heavy tongue and they say it cool, the CH goes, because that's how they hear it. And that's how they will pronounce it. The much that happens to the brain is that the brain's cognitive decline is where that you find that the understanding of the speech or the language start being affected by the match of how you hear it.
So it declines in terms of functionality, not
functionality.
size. Yeah.
Functionality. Now, that's even the worst thing because the end of it all is that you find patients getting dementia as a result of untreated hearing problem.
They forget things.
Yeah, it doesn't go direct there. You find that this person will start to forget, getting frustrated, handling small things, small tasks. This person, when they go to a noisy place, they cannot hold a conversation because the background noise is becoming so much of a nuisance to them. And then they find that, they just want to be by themselves or isolate themselves socially. That's how they find themselves. And then eventually you find that this person becomes so forgetfulness, cannot be able to, make small judgment here and there, and then becomes such a frustrating life. And then you find that these cases of dementia are resulting as from untreated hearing problem. So that's why you're saying, however mild it is time to look for a solution so that it can be rehabilitated and improve the way of life.
Hey, now that you put it that way, I mean, one would think, having a hearing problem is just about your ears and nothing else. But you see how it is now trickling to the different facets of your life. And I want to understand, though, how this affects the social and the emotional well-being of the individual.
Yeah.
I know is it 2 decades or?
Yeah, this year.
About 20 years in this, yeah? You've interacted with patients who've had this ranging from mild to even severe to those who even are deaf.
Yes.
How is their life socially and emotionally, looking like? Any challenges, things that they go through as a result of that one challenge of not being able to hear well?
Yeah, socially, they become quite inactive people because you find that this person used to socialize with other people and then they cannot be able to socialize if they have a hearing problem. But if they have the hearing problem sorted, they can engage their life normally. So you find these people used to go to the meetings. They used to contribute very, very well in their meetings. I mean, there were these guys that were sought after to talk much about their thing. They know best. But now you find that they are isolating themselves. They just want to be by themselves. Now, what that happens is that when you isolate yourself, and there is a problem that is bothering you, you start having kind of a depression within you. So the problem is that they get isolated, they stay by themselves, and they're not looking for a solution. So the life continues. One time, they'll be needed to be in such a situation where they are needed their contribution. And what happens is that they get frustrated and they cannot be able to follow up. So socially, you find that they become such an inactive beings that they are not, they're just questioning about their problem. But this is a problem which can be sorted so easily by coming to people like us who does all this thing here.
All right, we'll talk about that. But then how can society respond to such a case? Let's talk about the sort of support that they need from the people around them. Yeah?
Good. I started by saying that when you have a hearing impaired person in your society, in your home, it's not about loudness. It's about talking clearly and straight to them. So you make them understand. That is one thing. Second thing is encourage them that even if there's a hearing problem, as a matter of maybe it was caused by a medication that they are taking, maybe it is caused by an accident, traumatic experiences, is age-related hearing problem, encourage them that there's a solution towards this problem that you're having. But the support system has to be strong so that this patient not to feel that they are all alone by themselves and they are all isolated by themselves. Because, it's encouraging them of a solution. That I've known these people, I've had their reviews. I know somebody who knows them, who have gotten a solution. In fact, even bringing somebody, because with technology nowadays, with the information nowadays, that you somehow know somebody who've got a hearing problem somewhere, so that they can see and they can learn from somebody who's already been treated, back to work, back to their lifestyle, enjoying whatever they do best, and communicating very well.
All right. I have a lot of questions, but let me skip to something also significant here. Let's talk about how to prevent it. I know there's the treatment for those who are already part of the numbers, but then let's prevent first.
Yes, let's prevent first.
Let's prevent first. So how can someone prevent, developing that challenge of hearing? What are the habits or things that we can begin doing?
Yeah, you can do something. First is that I'd want to talk about the hearing problem affecting everyone at any single their life. It's not an age-related hearing problem anymore, and it has never been. It affects from children, young people, young adults, the youth, and also now the age-related. So let me talk to this young group, how they can protect it, because they have to. And if they don't, we are getting the statistic in our clinics going high, because they have to protect themselves from noise. Okay? I normally say is that if you're in a function and I cannot communicate to you at an arm length, that means at that far, I have to raise my voice. That noise is too loud already. We don't have...
But what's the fun without the loud music?
That's where we go wrong.
No, what's the fun?
That's where we go wrong. We've talked about noise-induced hearing problem happening at once. Let me see, I don't know how you were back in the college life, where you used to go to a noisy places to have fun, and then the following day you find like, I think I can't hear very well. That's something called temporary threshold shift. So the hearing has been somehow affected. It comes back, but some people, it can be permanent. Look, you went to have fun, but then the following morning, you have kind of a hearing problem. You see, like, I'm not hearing very well. Some people, it resolves, others it doesn't. So if at least they realize that, for the few hours that I went out and I cannot talk to somebody at an arm length, that noise is too much. I'm not saying that you should not go have fun. Avoid closeness to the speakers. So you can have somewhere in an open place, not in all closed up place. Why? Is because when you find that in a closed place, sound is pressure. It's quite of an energy. Those vibrations, they are so enclosed within you. But if it's somewhere with a high roof, open windows, that's not too bad. Although I will not encourage, but that's not too bad. But when you find that you are all enclosed in a small place, but the music is even shaking the walls, that's a bit dangerous. That can be prevented. The other thing can be prevented is using a cotton bud, because when you have impacted wax, you have something called conductive hearing loss. That once cleaned, it can be sorted out. But it can also be dangerous, because using those Q-tips or cotton buds, that you can perforate your eardrum. Now introducing a more serious cases where you have to go to theater to have surgical intervention. So they are not the best to be used.
Or the matchbox.
Yeah, that's now even
worse.
Even worse, and using the...
Sometimes it feels good.
That's what I hear, but you see, it's because when you start making use of this...
Do that.
Yes.
The more you go, the more it becomes nice.
It's because the more you use it,
dangerous.
The more you use it, the more you push wax to where the wax production doesn't happen. And then you see, to an extent, some people can have fungus infection. Which is not painful, but it brings that itchiness. So every time you itch your ear, you feel like relief. But you don't have to put something in your ear. You can just push it from there. You don't have to put it in the ear. You can just use a different way of doing it.
All right.
But avoid the cotton buds if it's possible.
If you can.
Yeah.
For the young people, he has been very, very categorical. The loud music, these devices you wear on your ears, the earbuds, the watch, and you put in loud music that even the person next to you can hear you, the music you're listening to, you're actually not doing yourself a favor.
In fact, some of these devices, they have got some kind of a levometer that have got different shades. You know, when you go up, there's a green, which green means more of, if you go with the traffic lights, it's okay. But when you go towards red, in fact, it pops up a message, you know, exposing to yourself to this point of may cause a hearing problem. That's a warning that should be able to serve as a good reason why you should not go to high volumes.
Plus invest in quality. Those gadgets also come.
Oh yeah.
All right. So let's talk about treatment.
Yes.
So what options are there currently? What do you do to decide this patient needs this kind of intervention, this one needs this kind of intervention? Just run us through the options that are currently available in case somebody already has hearing loss that has been diagnosed. Yeah,
that's a very, very good question because we get a lot of people calling about it. So hearing problem is not standard to everyone. So we get our patients calling us and ask us how much is the hearing device. We don't start there. We start by, you have a hearing problem? Yes, we do a hearing test. There are diverse hearing tests to be done, be it in pediatric, be it what we call pediatric audiology, and be it in general audiology where we're seeing adults. So depending on the age, depending on the referral, because most of them are referred by the doctors, there are different tests to be done. So from the test is when we start discussing what type of hearing problem is, because there are different types of hearing problem. So there's what you call conductive hearing loss, where you find that maybe it is the perforation of the eardrum, maybe it is the wax impaction, or maybe it's a middle ear that is not functioning as supposed to be. And at that point, we see what to do. Is it to clean the wax? Is it refer to an ENT surgeon for the intervention of surgical intervention for the perforated eardrum? So that's about conductive hearing loss. And then there's what you call sensory neural hearing loss, where you find that the hearing nerve has been affected. So this is the highest percentage that we find where it needs an intervention. Now, when you talk about sensory neural hearing loss, now it is also divided. Is it mild? Is it moderate? Is it moderately severe, or profound? So by the time you're looking at the solution or the treatment, is that you have to define all these things. Is a case conductive or is a sensory neural? If it's a conductive, send it back to the ENT doctor or send it back to the pediatrician. If it is sensory neural, it is as audiologists to start managing that case from that point. Now, it's us to know, is it mild? What solution is there for mild? Is it moderate? What solution is there? Is it moderately severe, or even profound? Now, when it comes to the solution for those cases, they're also different hearing devices or hearing aids that are supposed to be used for that. Where we find that, there's those discrete, there's also we call receiver in the canal, different technological level, also depends on the preference of the patient. All those things have to be in consideration. So much so goes into picking a device over a patient. Now, when it is severe to profound, we talk over the cochlear implants, where now we send to a team of doctors, including audiologists, speech therapists, ENT surgeon, because that has to be handled by a multidisciplinary specialist, because it is a case where a surgeon will come in, implant a device, and an audiologist will come in, do the rehabilitation and mapping of the process and things like that, and then speech therapists come in for those children who have been born with a hearing problem to start teaching them how to talk, how to develop speech. So it is a diverse case. So when we get a call and a patient says, I have a hearing problem, how much is the hearing aid? That question cannot be answered.
That's like the first thing. That's not
no, that's not the first thing.
That you should go for.
Yeah, that's a very difficult question.
Because I can't hear well,
yes, I need a hearing aid.
A device.
Yes, that's a very difficult question to ask, because the next thing you'll be asked by the audiologist or the receptionist at the hearing center is that, have you done a hearing test? They say no. Say, you need to do a hearing test so that we see how your hearing impairment is. In general, what I'm saying is that the hearing test, it's more or less of a prescription or a guide, one of the guide to take us through on how to give you a hearing aid. Because, look at it this way. You cannot say you are sick and I need medicine. For what? What are we treating?
Exactly.
Exactly, is it? Yeah. Yeah. So we have to look at it differently, that you have a hearing problem. Yes, it's good that you have a hearing problem, and that's a good stage because you have accepted. Now, let's look at it differently. How do we need to handle it? You need to come, do a hearing test, and then we start seeing the degree and the levels and the frequencies that have been affected, so that we can bring up solution. Because some people will come and say, but I hear my husband better than my sister. Those are two different things, because like my voice is deep. Some people, especially...
There are cases I can hear one person well, and no struggle hearing another person.
Yes. You can say, I hear so-and-so very well, but I cannot hear my grandchildren. Because there's different levels of frequencies that get affected. So it is quite of a complex. It is not as simple as it might be said. It's quite of complex looking at it. But when you come to us, we try to demystify it in a very nice way, so that you go step by step. And when you take through the patient step by step, they appreciate it so much, because they might say, I didn't realize that's how it is done. I just thought I just call in. And that's it. You're finding so many people they say, I have a hearing problem. Nowadays, there's online shops everywhere, and they buy a device. And when they buy those devices, 2-3 weeks, they start saying it is not working and it is too loud. That device is very dangerous, because we'll start having now, apart from the hearing problem that you had, you start introducing another hearing problem, which is noise induced, because this device that you're buying online is not a prescription device. And maybe you bring it to us and say, this is just an amplifier. It's not a hearing device. A hearing device is a medical device that has to be prescription done according to the test. And if you take that kind of result to any audiologist in town or wherever in the world, they'll agree with everyone that this has been correctly done and this was the right choice. So let's start the rehabilitation part of it.
So you can't buy a hearing device online. Don't do that. Go to the doctor to help you decide which one works best for you. But Daktari, so take us through the technology, and how it has advanced in terms of making these hearing devices. One thing you mentioned earlier was the sophistication in terms of even how it looks, just to sort of avoid stigma that when you go somewhere in public, everyone knows you're wearing a hearing aid. Nowadays, they look very, very cool,
they're nice.
For lack of a better term. But then in terms of functionality, how have they been developed? And do they address specific needs of specific patients, like one who needs it to be loud, one who needs, I don't know. I just want to understand the complexities of how they're made to meet the various needs that you have explained to us.
People would want to understand as clear speech is about the loudness. It's not about the loudness. It's about the clarity. Yes. Loudness just comes way, maybe number 3, number 4 there. But how is this device giving you the clarity of the sound? Now, today's hearing aids, they are we're using their AI-driven technology, artificial intelligence-driven technology, and what you call deep neural networking system. So it's a way that, the hearing aids, they are mimicking the way the brain works. So when you see those high-level technology hearing aids, is that they mimic the way the brain works. And then that is so much of beneficial to the patient, because what was happening to their cognitive function in terms of declining, it is more helped or rehabilitated to an extent that this person with their hearing is more in a normal life. So if you look back at the history, we started from what you used to call pure amplification. Pure amplification is what people are selling online nowadays. So you're looking about 50 years of technology being sold online and being called hearing aid, which is, it's causing more damage. We don't want to talk much about that. So what used to have to happen, the pure amplification, is just loudness. So everything used to be loud. And since this person has been a quiet word of themselves, so to say, that means that the sound has not been loud enough for them. These devices were 50 years ago. was giving some help, is it? Because, I mean, now they can hear maybe a dog bark, maybe they can hear a doorbell, maybe they can hear all those kind of sounds. But then the technology has come changing day by day. We moved from there to what you call digital and programmables. So these were the hearings that were somehow trying to sieve more of background noise, to sieve more of, it's not pure amplification as such, but somehow it was an improvement until to where we are now today, that the hearing aids are mimicking how the brain works. So you find that small thing behind the ear, it's just got a chip that works so well to bring up the conversation, the speech clarity to more or less to where a normal conversation or how normal hearing works. Yeah, so that's how we have moved.
Interesting. Yeah. At what cost, though? The cost issue has been quite a challenge, and I don't know whether our health insurance is even covering this these days. The last time I checked, it was a big discussion.
Yeah, it's a big discussion. And talking about the cost also, you see, as I mentioned to you, how the patient calls and they say, I need a hearing aid. The hearing aid depends on the hearing severity. Okay, so we cannot say that it costs this. We see now, just to bring it closer to what we use every day, like let's say a phone, like say one of brand of the phone, the brand ABCD, and then a brand XYZ. So there's XYZ Max, there's XYZ Pro, there's XYZ Pro Max. That brand is XYZ, is it? But it has moved from different technologies. So what that means is that the hearing devices is, as I said, patient preference and according to what we see from the results and according to achievement, what it gives. Because some of these hearing aids, they are so convenient to even the patient that even they have, when you want to use it as a Bluetooth, it converses to your phone. It connects to your phone and then you can communicate. So there are a wide range of hearing devices that we cannot pick one and say, this is the price. No, this is not the price. The price depends on how much of technology level, because you find there are 24 channels hearing aids. That means is the high-end hearing aid. And there's a 12 channels hearing aid. That means more of a lower channel hearing aid. But inside that also, there's also a complexity of how it is worn. Is it rechargeable? Is it battery operated? So all those kind of things, yeah. So it depends. Right. Yeah. Right.
There's a question that just came in about how this test is done.
Yep.
Sometimes somebody was mentioning to me that you wear headphones and then there's a sound that is played at a particular frequency and then you're asked, you're assessed based on that. How accurate is it? And just tell us a bit about how that test is done, what you're trying to achieve at that.
Yeah. So that test has to be done in a sound-treated room. That's the first thing. The second thing is that the machine, which is called an audiometer, has to have an update, or it has to be calibrated to do an accurate results. And three is that the patient must understand what expectations you're looking for. So you get in a room which is soundproofed with below, our room is about 30 decibels. So it's normally below 36, 34 there. So when you do it, it has to be sound treated. That means the only sound that this patient is listening through the headphones is the headphones. And also you see the headphones also will give some insulation of outside sounds. So you achieve much into bringing the outside sounds, the patient to concentrate on what he's hearing or she's hearing. So once you give the instruction, and the instructions has to be clear to the patient, and you start doing the test. As you continue doing the test, you can observe on the screen on what the patient is doing, whether it's correct or not. And then if it is not correct, you can always give them instruction and repeat the sound. So the sound has to be done from mid-frequency towards high frequency, and then from mid-frequency to low frequency to try to achieve what we call an audiogram. An audiogram is just a graph that runs across from low frequency to high frequency, and that helps us to explain the severity of the hearing problem. That can only be done to a patient who is understanding the instruction, right? How about the children? The children, they have got different tests to be done. Remember I said that even a day one child can be done a hearing test, which technology is allowing us to do all these things because we need to assess the functionality of the ear. So there are other tests to do for the children who have got hearing problem because they cannot understand instructions. Such tests can also be done for people who pretend that they don't have, they have a hearing problem.
Can you pretend? Surely you would want to be part of that.
Yeah, for compensation purposes, you know.
Oh, really?
Yeah.
This is Kenya.
So,
anyway, as we wind up, Daktari, there's somebody who's asking, you know, so where can I go for proper checkup and whether hearing loss is reversible? Those two questions as we wind up.
Hearing loss, it's one, it can be reversed if you sudden sensorineural hearing loss. If you wake up having a hearing problem, rush to the doctor. Don't wait to see what happens next. Go to the doctor, let the doctor assess you, let the doctor start medication immediately. So don't wait even a day. So if you sleep today, wake up with a hearing problem, rush to the doctor. It can be resolved and can be reversed. That can be reversed. Now for the gradual hearing problem, it is us who does the diagnosis for the audiologist. Like at Doctors of Hearing, we do this so much because we have to look at the hearing problem of a patient and assess. So where do you go or who do you see for a hearing problem? They are called hearing centers. And the people who run hearing centers, they are called audiologists. So, or hearing doctors, whatever you want to search for. And then when you do that, is that you'll get to be taken through the whole system of how to understand. And I say that, you know, you don't have to keep on being washed your ear and each and every ear, and being told that it will resolve. If you've done it once, the wax came out and you saw it. If you've done it the second time and there's nothing being shown to you, because anything that comes from your body need to be you have to understand what it is. From wax, yes. When we clean our ears, when we clean patients' ears, we have to show them this is what came out. Because the hearing problem, especially where the sensorineural hearing problem is, it's not about of cleaning anymore. It is more advanced that you have to be seen by us so that we can be able to make conclusive on it and start rehabilitation and what you call audiological management of it.
All right, thank you so much. Today it was all about, you know, sharing information about your hearing health, if I may call it that. And in case you have a challenge, what is it that you can be able to do? What points of action you can be able to take? And generally how you can improve your hearing, you know, care. Just a few days after we marked the World Hearing Day, I've been engaging Dr. Richard Mwangi, a consultant audiologist who is also working very closely with the Doctors of Hearing right here in Kenya. Thank you so much, Daktari.
Thank you very much.
For creating time for us. Looking forward to have this conversation again with you. Let's continue. Thank you so much for also creating time for Daybreak this morning. We really appreciate your time and company. My name is Safina Chengoma. It's a wrap. Have a lovely day ahead.